Good day everyone, I'm Roxanne Cabilak from BPED 2A. So my part is assessment and identification. Teacher observation and listen to students' communication. If not parents, teachers are one of the best identifiers for who have problems with their speech and language. Since most of the time of the day, learners stay inside their classroom. Teachers know better about the capabilities of their learners, like the way the learners understand information and how they communicate their thoughts to the entire class. As a classroom teacher, you may have limitless opportunities to observe the child in their natural setting, where they normally use language for academics or social activities. Hence, teachers can contribute significantly in providing relevant data for the identification process. The use of checklists and anecdotal records in describing the student's classroom performance and behavior for possible language disorder must be reflective of the language content, form, and use. Gaya nga dun sa nabasa natin na yung mga teachers, sila yung mas nakakaalam or mas na-identify nila yung mga bata na merong speech and language disorder. Kasi most of the time, nasa school yung mga bata. And mas na-obserbahan sila ng mga teacher kesa sa mga parents nila. And yung paggamit naman ng checklist and anecdotal records, yung checklist, ito yung listahan ng mga possible na symptoms ng communication disorder na ginagamit upang makita kung ang isang bata ay may problema sa pagsasalita or sa paggamit ng language. And yung anecdotal records naman, ito naman yung personal na data ng mga teachers tungkol sa mga observation nila sa pagsasalita ng isang estudyante. Next, Comprehensive Speech Language Pathology Assessment. The American Speech Language Hearing Association, or ASHA, as an association of experts, underscores the complex process of assessing learners who are at risk of having communication disorders. Hence, ASHA proposed the Prepared Practice Patterns for Professions of Speech-Language Pathology, 2004, that outlined the essential content of a comprehensive speech-language pathology assessments are case history, including medical status, education, socioeconomic, cultural, and linguistic backgrounds, and information from teachers and other related service providers. Next is patient, client, student, and family interview. Next is a review of your auditory, visual, motor, and cognitive status. Next is standardized and or non-standardized measures of specific aspects of speech, spoken and non-spoken language, cognitive communication, and swallowing function, including observations and analysis of work samples. Next is identification of potential for effective intervention strategies and compensation. Next is the selection of standardized measures for speech, language, cognitive communication, and or swallowing assessment should take into account documented ecological validity and cultural sensitivity. And last, follow-up services to monitor communication and swallowing status, as well as ensure appropriate intervention and support for individuals with identified speech, language, cognitive communication, and or swallowing disorders. So next is assessing learners with English language learners. Language assessment may have a double standard if the learner being assessed is an English language learner or if his/her first language is not English. It is important that the assessment tools used for identifying communication problems must be culturally fair to all learners. English language learners may experience challenges in word pronunciation, syntactical rules, grammatical errors, vocabulary, fluency, and comprehension in English as their first language, may influence the way they learn English. Teachers must keep in the mind the implications of theories of the second language acquisition, where learners may learn their second language at different rates. So before assessing, check the student's background about their native language. So now let's proceed to educational approaches. The speech language pathologists must work closely with teachers to provide services that are relevant and appropriate based on the speech disorder of the child. Here are some strategies that teachers may use to help improve areas of communication. So first is treating speech sound errors. The aim of educating learners with communication disorder is to allow learners to practice their newly developed speech skills in an accepting environment. So dito sa treating speech sound errors, ini-aim nito na hikayatin ang mga bata na mag-practice sa pagsasalita nang walang takot na magkamali. Here are some considerations for teaching learners with communication disorder. 1. Provide good models of appropriate speech. Serve as a model in speaking clearly with correct pronunciation and invite students to demonstrate their speaking abilities. Dito sa providing good speech models, as a teacher, dapat yung way ng pagsasalita mo is malinaw at tama para matutunan agad ng students kung paano yung tamang pronunciation. Focus on quantity more than quality of speech. Attend to the content of the communication instead of calling the attention of the child on their mispronounced words. Focus on quantity more than quality of speech. Ibig sabihin, mas mahalagang hikayatin natin yung mga bata na magsalita ng mas madalas kaysa ituon natin yung pansin natin sa pagiging perpekto ng kanilang pagsasalita. And attend to the content of communication instead of calling the attention of the child on their mispronounced word. Sa halip na itama natin agad yung mga maling bigkas ng bata, mas mainam na mas bigyan natin ng pansin yung kahulugan o mensahe ng kanyang mga sinasabi. And last, number 3, provide opportunities for practice. Encourage students to practice what they have learned verbally in their natural setting. Dito naman sa provide opportunities for practice, yung pagbibigay ng chance sa mga students na mag-practice sa tunay na buhay is nakakatulong sa mas effective na pagkatuto. Sa pamamagitan ng patuloy na pagpapractice, tulad na lang ng pakikipag-usap sa pamilya o sa kaibigan, gamit ang bago nilang natutunan, ay mas napapalalim nito yung kanilang pangunawa. And also, yung paggamit ng natutunan nila sa kanilang natural settings ay nagpapalakas ng kumpiyansa at nagiging mas makabuluhan yung kanilang pagkatuto. Next is treating fluency disorders. There is no single best method in treating fluency disorder, especially stuttering. There are a variety of factors that contribute to its development, and there are several recommendations to control its occurrences. Teachers must consider the following recommendations when helping in treating fluency disorder. University of Delaware 2013. Here are the following recommendations. First, let the learner understand that stuttering is not something to be ashamed of. Second, show your support to the learner when he or she is talking. Third, find out the child's opinion about reasonable classroom expectations. Fourth, provide a good speech model by speaking slowly and clearly. Fifth, use shorter and simpler sentences when giving instruction and explaining. 6. Avoid interrupting the student when speaking. 7. Allow more time for the student to respond in class. 8. Avoid making suggestions to improve fluency unless the suggestions have been recommended by the speech language pathologists. Refrain from commenting to the child, slow down, speak clearly. 9. Compliment and praise the student's efforts unconditionally. 10. Reduce or eliminate activities within the classroom that reinforce debate and verbal competitiveness. 11. When reading aloud, allow the students to read along with someone else. 12. Know what situations cause more stuttering. 13. Listen attentively to the child's message. And last, 14. Understand that people that stutter may have worse days.